There is a photograph that stopped millions of people in their tracks the moment it surfaced online. A man lying in a hospital bed, doctors surrounding him, and a close-up image beside the scene appearing to show a damaged nasal implant, a small, artificial structure that had supposedly collapsed inside the most famous face in the world. People stared at it, people shared it, people argued about it. Was it real? Was it staged? Was it the final visible proof of decades of decisions that had quietly dismantled one of the most recognized features in entertainment history? Here is what we know for certain. Michael Jackson's nose tells a story that goes far deeper than any tabloid headline ever captured. It is a story about childhood wounds, medical consequences, physical pain, and the invisible cost of chasing an image under the most intense spotlight the modern world has ever produced. And the deeper you look, the more complicated that story becomes. So let's go back to the beginning. Not to 1984, not to Thriller. Further back than that, where it began, a father's words before any surgeon ever touched Michael Jackson's face. Damage had already been done, and it was done with words. Growing up as one of 10 children in a demanding household in Gary, Indiana, Michael was subjected to relentless pressure from a very young age. Rehearsals were not optional, mistakes were not tolerated, and Joseph Jackson, the family patriarch, was not known for gentle encouragement. By multiple accounts from those close to the family, Joseph frequently mocked Michael's appearance, particularly his nose. He reportedly called it wide. He reportedly made those comments in front of others. Think about that for a moment. A child who would grow up to sell over 400 million records worldwide was being told repeatedly that his face was something to be ashamed of. Ask yourself this: if you spent your most formative years hearing that one specific part of you was wrong, how deeply would that shape every decision you made about your appearance afterward? For Michael Jackson, the answer would play out publicly over the next 4 decades. The first procedure, and what it really started. In 1979, at 20 years old, Michael Jackson underwent his first rhinoplasty. The publicly stated reason was functional. A broken nose sustained during a dance rehearsal had reportedly affected his breathing. The surgery produced a slimmer nasal bridge and a noticeably refined tip. Jackson's appearance on the cover of Off the Wall reflected the early result to many observers at the time. The change seemed subtle and reasonable, but this procedure opened a door that would prove very difficult to close. Medical professionals who have studied Jackson's transformation note something important. The decision to alter the nose after a single injury is understandable and common. What is far less common is the pattern that followed over the next 2 decades. Each subsequent procedure further reduced cartilage. Each intervention left the underlying structure slightly weaker than before. The nose is not simply a cosmetic feature. It is a functional architecture, a system of cartilage and soft tissue that regulates airflow, protects the airway, and plays a direct role in vocal resonance. When that architecture is repeatedly modified, consequences accumulate. Jackson would later maintain in interviews that his procedures improved his breathing. Specialists in nasal surgery, however, have generally stated the opposite, that repeated rhinoplasties almost always compromise nasal function over time rather than improving it. The 1984 accident and the cascade it triggered. If the first procedure set the process in motion, the 1984 Pepsi accident changed its trajectory permanently on January 27th of that year. During the filming of a commercial that would become one of the most replayed accidents in advertising history, a pyrotechnic malfunction ignited Jackson's hair while he descended a staircase. The resulting burns were severe 2nd and 3rd degree damage to his scalp and portions of his face. The physical pain was immediate. The consequences were longer and more complex. Reconstructive surgery was necessary. Skin grafting procedures to address the damaged areas introduced a new dimension to Jackson's relationship with medical intervention. Pain management became a daily reality, and the medications prescribed to manage that pain, strong, effective, and highly addictive, became a presence in his life that would never fully leave. Here is a detail that most coverage of this period overlooks. The burn damage was not limited to what cameras captured in those now famous emergency photographs. The scalp damage from that event and the repeated procedures that followed it caused widespread follicle damage. The hair Jackson displayed publicly for the remainder of his career was in most cases not his own. Custom-made lace-front wigs, designed by dedicated stylists and secured with medical adhesive, maintained the signature image that audiences recognized worldwide. After his death in 2009, his autopsy confirmed what those close to him had known privately. Beneath the wigs was sparse, patchy natural hair. The iconic silhouette that millions associated with one of history's greatest performers was, in significant part, constructed. Does that change your perception of his performances? Or does it add another layer of respect for the discipline required to maintain that image under such conditions, the public admission, and what it left out? Michael Jackson was not someone who gave the public everything. He understood narrative control in a way that few celebrities of any era have matched. In his 1988 autobiography, Moonwalk, he addressed the mounting speculation about his changing appearance directly. He admitted to 2 nose surgeries and the addition of a chin cleft. He presented these as deliberate, minimal, and complete. "That is it, period," he wrote. That statement, clear, firm, and repeated in subsequent interviews, became his official position for years. The chin cleft, which Jackson had added, and which gave his jawline a sharper, more classically structured appearance, was framed as a simple aesthetic choice. The 2 acknowledged nose surgeries were presented as responsible corrections rather than the beginning of a larger transformation. But medical analysts and those who worked directly in his circle would later suggest the actual number of procedures was significantly higher. One physician affiliated with his primary surgeon stated that Jackson underwent multiple rhinoplasties, cheek implants in the early 1980s, and eyelid surgery, with appointments reportedly occurring as frequently as every 2 months over extended periods. In a 1993 interview with Oprah Winfrey, Jackson directly denied any work on his cheekbones or eyes. He was specific and emphatic. The gap between those denials and the claims of medical professionals who treated him remains one of the most debated aspects of his public history. Not because the truth can now be fully established, but because the contradiction itself reveals something important. Jackson's relationship with his own image was deeply private. Even when the image was endlessly public, the structural collapse. By the late 1990s, something had shifted in ways that went beyond cosmetics. Accounts from those who worked closely with Jackson during this period describe a nose that had been architecturally compromised. Cartilage that had been reduced through repeated procedures could no longer maintain the structural support required for basic nasal function. A condition that surgeons call internal nasal valve collapse, where weakened tissue folds inward during inhalation, had reportedly developed. The lower lateral cartilage, responsible for keeping the nostrils open and maintaining airflow, had been diminished to a point where it could no longer perform that function reliably. For anyone, this would be a serious medical issue. For a performer whose entire career depended on breath control, physical endurance, and vocal precision, it was something approaching a professional crisis. Jackson frequently performed shows lasting well over an hour. The stamina required for his choreography alone was extraordinary. Now add restricted airflow, the compensatory habit of mouth breathing, the resulting dryness of vocal cords, and chronic throat irritation, and the portrait of his final performance years becomes significantly more complicated than the one presented on stage. A family friend quoted in several subsequent biographies described Jackson struggling noticeably for breath while simply walking between rooms. Whether or not that specific account is fully accurate, the broader medical picture is consistent with what respiratory specialists have described as the predictable outcome of repeated nasal surgery, the prosthetic, and the deeper revelation. Perhaps the most startling detail to emerge from Jackson's final decade is the account provided by music video director Rudy Dolezal, who worked closely with Jackson during the 1992 Dangerous tour, stated that Jackson was deeply reluctant to be seen without a prosthetic nasal tip. On days when the prosthetic was not in place, Jackson reportedly described himself as not having a nose. That statement, whether interpreted literally or emotionally, captures something profound about where his transformation had taken him. The prosthetic tip, attached with medical adhesive and covered with carefully matched makeup, allowed Jackson to maintain the visual continuity that his public image required. Without it, the structural damage to the nasal tip was reportedly visible: discoloration, scarring, and a shape that no longer resembled the carefully refined contour that decades of procedures had been designed to create. Pause and consider that for a moment. A man who had spent years attempting to perfect a specific appearance now required an artificial component simply to recreate that appearance for the world. The irony embedded in that reality is one that neither admirers nor critics of Jackson's choices can easily dismiss. Vitiligo, lupus, and the skin misunderstood. No aspect of Michael Jackson's physical transformation generated more misunderstanding or more deliberate misrepresentation than the gradual lightening of his skin. The assumption made by many observers, and stated outright by many commentators, was that Jackson was attempting to erase his racial identity. That assumption was wrong. It was also, in the view of many people close to him, deeply hurtful. Jackson publicly confirmed his diagnosis of vitiligo in 1993. The condition, an autoimmune disorder in which the immune system attacks melanin-producing cells, causes irregular patches of depigmentation across the skin. In Jackson's case, the condition was reportedly extensive. His dermatologist, Dr. Arnold Klein, additionally confirmed a diagnosis of discoid lupus, an autoimmune condition that causes skin inflammation and heightened photosensitivity. Managing the uneven appearance produced by vitiligo, under medical supervision, involved the use of prescription hydroquinone-based creams to reduce pigmentation in areas that retained it, creating a more uniform complexion. Stage makeup compounded the visual effect. After his death, the autopsy examination confirmed depigmentation patterns on his face, chest, abdomen, and arms that were consistent with vitiligo. The evidence was not new. Jackson had been discussing his diagnosis publicly since 1993. But the narrative that his skin change represented something chosen rather than something endured had already taken hold, and corrections rarely travel as far as the original accusation. What does it say about the way we consumed Michael Jackson's image that a documented medical condition was routinely reframed as a moral failing, the skin's structural fragility? Beyond the pigmentation question, those who observed Jackson closely during his later years noted another quality about his skin. It appeared unusually thin, almost translucent in certain lighting conditions. With a texture that many described as fragile, this characteristic was not simply cosmetic or surgical in origin. Long-term corticosteroid treatments used to manage the chronic inflammation associated with his lupus have a known side effect. They reduce skin thickness over time and impair the natural healing process. The combination of autoimmune disease, repeated surgical interventions, heavy topical treatments, and scar tissue accumulation produced skin that was structurally compromised in ways that had nothing to do with vanity. This was the result of years of managing a complex, painful medical situation without the benefit of privacy that most patients take for granted. Every inflammation, every reaction, every treatment adjustment happened under a level of public scrutiny that no medical patient should reasonably have to endure. The financial dimension. Estimating the total financial cost of Jackson's procedures is difficult, because his private medical records were never made public, but several analysts and medical professionals have attempted the calculation. British plastic surgeon Alex Carides estimated that Jackson underwent at least 20 cosmetic procedures, with a total cost in the range of £130,000 for those procedures alone. The Chicago Tribune reported that a single cluster of 9 facial procedures at Beverly Hills rates could cost between $40,000 and $50,000. With additional specialized work priced separately. When factoring in Jackson's specific circumstances, celebrity surgeon fees, the frequency of reported visits, maintenance treatments, injectable fillers, scalp procedures, and the span of several decades, some estimates place the lifetime expenditure in the range of $1 million. That figure is not confirmed. It may be an overestimate or an underestimate. What it does illustrate is the scale of ongoing commitment, financial, physical, and psychological, that this transformation represented over Jackson's adult life. The addiction no one wanted to see. In November 1993, Michael Jackson halted the remaining dates of his Dangerous World Tour and released a public statement he was struggling. He had become dependent on prescription painkillers. The original prescriptions, he explained, had been issued following reconstructive surgery after the 1984 burn incident. What began as medically appropriate pain management had, over time, evolved into something he could no longer control on his own. His legal team confirmed that he was unable to function normally during that period. He entered rehabilitation with support from close friends, Elizabeth Taylor among them. The statement was remarkable for its honesty. It was also, in retrospect, a window into a cycle that would continue for years. Each new procedure brought new recovery. New recovery brought new pain brought new medication. The cycle reinforced itself. The doctor who had treated Jackson since 1978, Beverly Hills surgeon Dr. Stephen Hofland, later expressed distress over the circumstances surrounding Jackson's death and questioned the medical decisions made in his final years. His decades-long relationship with Jackson placed him at the intersection of cosmetic medicine and the broader pharmaceutical story that ultimately contributed to Jackson's end. The final chapter of that story is well known. On the morning of June 25, 2009, Dr. Conrad Murray found Jackson unresponsive in his bed at his Holmby Hills home. Emergency responders arrived and worked for approximately 42 minutes before transporting him to Ronald Reagan Euclid Medical Center. At 2:26 that afternoon, Michael Jackson was pronounced dead at the age of 50. The toxicology report identified propofol, benzodiazepines, and other prescription sedatives. Authorities ruled the death a homicide. Dr. Murray was subsequently convicted of involuntary manslaughter. What the world lost and what it missed while he was alive. The memorial held on July 7, 2009, at the Staples Center in Los Angeles drew an audience of millions across the globe. Artists performed. His brothers stood together, each wearing a single sequined glove in tribute. His casket, a solid bronze model finished in 14-karat gold plating, lined with blue velvet, entered the arena as a gospel choir performed. The ceremony closed with an instrumental version of Man in the Mirror. It was a farewell worthy of the scale of his influence, but it also marked, for many, the moment when the full weight of what had been lost finally registered. Here is a question worth sitting with. How much of Michael Jackson's story did we actually follow while he was alive, and how much did we simply project onto him? We watched his face change. We speculated. We mocked and we celebrated. We consumed the transformation as entertainment while the person experiencing it was managing pain, navigating addiction, facing legal battles, and carrying insecurities that had been planted in him before he was old enough to understand what they would cost him. The nose that became a worldwide fascination was, in the end, an entry point into a story that most audiences never fully read, the voice beneath the image. There is one final detail that deserves its place in this story. Specialists who have studied the relationship between nasal structure and vocal performance have noted that the progressive restriction of Jackson's airway almost certainly affected the instrument that made everything else possible. Chronic mouth breathing caused by nasal valve collapse produces vocal cord dryness and throat irritation. Restricted airflow affects breath support. Breath support is foundational to the kind of sustained, dynamic vocal performance that defined Jackson's career. Dr. Pamela Lipkin, a specialist in nasal surgery and vocal health, has stated that repeated rhinoplasties rarely improve vocal ability and frequently compromise respiratory function. The procedures Jackson underwent in the name of appearance had over time quietly placed constraints on the voice that generated his legacy. That may be the most quietly devastating detail in this entire story. The thing he changed most visibly may have cost him, in part, the thing that mattered most fundamentally. Why this story still matters. Michael Jackson died more than 15 years ago. His music remains everywhere. His influence is visible in the work of artists across virtually every genre. The moves, the production techniques, the performance philosophy, all of it has been studied, borrowed, and expanded upon by generations of artists who came after him. But his story, the full story, not the tabloid version, is still being understood. It is a story about what happens when a child is taught that his face is a problem. About what happens when fame removes every layer of privacy that protects a person's ability to manage their own struggles. About what happens when the medical interventions meant to help gradually accumulate into something much harder to reverse. It is also a story about the way audiences consume celebrities. We watch, we comment, we form judgments, and very rarely do we pause long enough to ask what the person on the screen is actually experiencing. So we want to ask you something directly. After hearing all of this, not just the headlines, but the medical details, the childhood context, the compounding consequences, how do you see Michael Jackson's transformation now? Has your understanding shifted? Share your thoughts below. These conversations are how this community builds something worth coming back to. Your perspective matters here, not just as a viewer, but as part of a genuine discussion about stories that the surface level never fully tells. And if there is another figure in entertainment history whose story you think deserves this kind of deeper examination, say so in the comments. The most compelling suggestions will shape what comes next.